Welcome to Howard County Public School System Delegating Nurse Training Program for School Health Assistance for Mickey G-Tube Medication Administration. This presentation consists of 4 parts. Part 1, Laws, Regulations, and Guidelines. Part 2, Overview of School Nurse Rights. Part 3, Overview of Medication Administration. And Part 4, Reviewing the gastrostomy tube, feeding tube, medication administration procedure itself. Part 1. The objectives are, at the conclusion of this training session, the participant will state the law that establishes school health guidelines, state the regulations that govern the practice of the registered nurse in the school health setting. 3, describe the criteria from the delegated nurse function regulations which must be utilized when delegating nurse delegates care. Number 4, describe the supervision of the delegating nurse must provide according to the delegated nurse function regulations. The laws that are involved on the federal level, the Individuals with Disabilities Education Improvement Act of 2004, which nursing services, it encompasses treatments, assessments, counseling, tracheostomy, and G-tube care. On the state level, the Maryland Nurse Practice Act. Standards of Practice, which is the COMAR, 102709 is the section. The RN may assign nursing tasks or delegate nursing functions to the school health assistant when they can verify that the person's competency to perform the task is appropriate. Observe the performance of the task on a regular basis. When a task is performed incorrectly, rectify the situation by correcting the error and giving instruction, and correct the manner in which to perform the task. As long as the delegating registered nurse follows the standard of delegation, it is not true that if a mistake is made, it's my license. The registered nurse may prohibit continued performance when the task is incompetently performed. When the continued performance after remediation demonstrates incompetence, then the registered nurse must prohibit delegation of the task. Delegation of nursing functions under the COMAR section of 102711 is the criteria for delegation. The registered nurse must have reached a judgment that indicates the delegation of the tasks shall be in such that in the judgment of the nurse, the task can be properly and safely performed without risk to the welfare of the student. The criteria for delegation is when delegating a nursing task, the nurse shall check to be sure that the task will be performed on a routine, regular basis in exactly the same way without the individual needing to make judgments based on the student's response. Through assessment, that the student's healthcare needs are chronic, stable, uncomplicated, routine, and predictable. And then the third criteria for delegation is a nursing task delegated by the nurse may not require the health assistant to exercise nursing judgment or intervention except in an emergency situation. Examples of an emergency situation are anaphylaxis, administering an EpiPen, a seizure, administering Diastat, hypoglycemia, administering glucagon, an opioid overdose, administering Narcan. The delegation review and checklist is completed every 45 days according to the Maryland Nurse Practice Act. The tasks for the 45 calendar day delegation review consist of reviewing of the order for the 5 rights for nursing administration, assessment of the student, the status that it's chronic and stable, that it's unchanged from the initial delegation situation, the written directions to perform the activity, observation of the competency of the individual performing the task, to direct changes when necessary, and to assess the environment to assure that it is supportive and safe for the person to perform the activity. The guidelines are that the school health assistant must hold 2 certifications that are renewed every 2 years. They must be a certified medicine aide and they must be a certified nursing assistant. A nurse may delegate administration of the following medications to the school health assistant according to these regulations. They may delegate a meter-dosed inhaler, a nebulizer treatment, a gastrostomy tube medication administration, which we're reviewing here, and oral medication. Part 2, the overview of the school nurse rights. The objective of this portion of the video is, at the conclusion of this training session, the participant will state the 5 rights of delegation. The 5 rights of delegation are that it's the right task, one that is delegatable for a specific student, it's the right circumstance, which is the appropriate patient setting, available resources, and other relevant factors considered, like privacy and the correct surface to set the patient on. That it is the right person. Right person is delegating the right task to the right person to be performed on the right person. That would be the nurse delegating to the school health assistant for the specific student. Number 4, the right direction and communication. Your communication needs to be clear, concise, description of the task, including its objective limits and expectations. And the right supervision. Appropriate monitoring, evaluation, intervention as needed, and feedback. Especially this is important when you're concerned that the delegated task is not being performed appropriately. Number 3, the overview of medication administration. The objective here is that at the conclusion of this training session, the participant will list the 6 rights of medication administration. And those are the 6 rights that are in standard for nurse or school health assistant: the right student, the right medication, the right dose, the right route, the right time, and number 6 is the right documentation. Accurate documentation occurs after the administration of the medication, not before. In a new medication medication order is required for each new school year dated on or after July 1st. Authorized prescribers consist of a physician, a dentist, a physician's assistant, or a nurse practitioner. If the medication has not been prescribed by these practitioners, it is not a valid medication order. A parent cannot write an order to give their child a medication. It has to come from a licensed professional. Now for part 4, review of the gastrostomy feeding tube medication administration. The objective. At the conclusion of this training session, the participant will demonstrate the correct procedure for administering medication through the Mickey G tube. Okay, this is our student, and here's their Mickey button. Okay, we're going to take the locking portion of the tube, connect it at the indicator, hold the button still, turn it to lock the tube. And then it's very important to always clamp the tube. Make sure the tube is clamped, otherwise the gastric secretions will leak out of the tube. Now there are 2 ports on the end of the tube. One port is a medication port, the other is a flushing port, or where the feed goes through. Make sure those 2 are clamped as well, are closed as well. Okay, and you're going to measure up the medication, for example 5 cc's of the Carafate. Okay, so we'll get the 5 cc's. Now, some orders are, if it says to flush with water first, we'll flush with water, otherwise it's fine just to put the medication in. You're going to connect the syringe to the med port. Then you're going to unclamp the tube. Insert the medication, clamp again, remove the medication syringe, insert the plug. Now you're going to take your water flush, and whether the doctor's order says 5, 10, 15, follow the doctor's order, and then you're going to attach that syringe, unclamp the tube, the extension tube, flush with the water, clamp the extension tube. You always want to visualize in the tube that all the medication has passed. If you still need a little bit more water, use that, but just keep it accurate as you can. But you don't want to leave any medication in the tubing. If the medication is in the tubing, it didn't go into the child. So if you've determined that everything is flushed and through, then you untwist the tube. And then put the button back in. And then the student is ready to go back to class. Thank you. Any questions? Thank you.